Okay.
Hey guys, welcome back to my YouTube video channel. What an excited afternoon. I have Dr. Bryan Osterday on my channel today, and we're going to talk a little bit about uh, dentists and how dental disability can be a very important information that you should get ready to learn to know more and repair yourself in case if in the future if you cannot really do any more dentistry with your hands. And Dr. Bryan asked today he's been through with his own experience, and he would love to share with us some of the key point that he want to help us out and repair ourselves in the case if we cannot do any more dentistry. The, without further, I just want to introduce really quick Dr. Bryan asked today on my show. Dr. Bryan,
Hello, how are you doing?
great, thank you. Thank you for being on the podcast today. It's very important for the reason I'm the one that reached out to you on the dental natural group, and because you have post something that very important, and it's affect a lot of dentists. As we work long enough, we will experience what you experience, and pain, discomfort in our body is part of the aging process, but also part of the occupation that we're doing. And please share us your who you are, and how long you've been doing dentistry and what you've been leading to what you are doing right now.
Okay, so we'll back up. I graduated from Ohio State University in 1998, the College of Dentistry, and started practicing in Cincinnati. My father's a dentist, so I practiced alongside him. Our practice was going incredibly well. Everything was going according to plan. We had a wonderful production, great staff. Everything was perfect. And then I started having some carpal tunnel symptoms. I started having some tingling in my hands when I was doing longer procedures. Said, I need to get that fixed. So I went in for a procedure, ended up, long story short, with permanent nerve damage in my hand,
Wow,
secondary to carpal tunnel surgery.
wow,
I discovered that my disability policy that I had put in place had some things in it that I didn't realize or understand or know. And I thought I was on top of things financially speaking. I had done really well saving. I had done really well trying to be on top of everything in that world,
hmm,
except I was caught by surprise on some of this. And I said, boy, if this could happen to me, it could happen to others as well in our profession. So I basically started learning everything I could. I started really trying to understand the disability insurance world, particularly for dentists. I partner with a financial firm, and now I spend a large portion of my time helping other dentists all across the United States through my firm and through my dental advisory network of or group that I work with. And we meet, help people understand the disability world, what to look for, what not to look for, the good and bad and ugly of what they have. Because really the important thing is the biggest asset that all of us have as a dentist is our ability to earn a future income. And
hmm,
if we have that taken away from us, there's a problem. And sadly, too many of us in this profession haven't planned properly or accordingly, or have listened to some guy tell them that they're in a good place. And I find literally on a daily basis that not to be true, speaking with people all over the country. And it's sad to me. So, what I do is I help people, if they so choose, to remedy that and get themselves into a better position. So, a couple of the things that we really feel, I think you asked me to possibly talk about some of the things that we want to see in policies. I'm going to be very general. I will say that there are a lot of insurance companies that will provide disability insurance for dentists. And I see a handful rise to the top over and over again. And some of the commonalities we see within these companies are certain things like I think it's very important for the policy to be non-cancelable and guaranteed renewable. I think that you have to want to be in control of that. The company can't cancel it. You have to be the one that initiates a policy being turned off by not paying for it, for instance. I like the idea that the company is not going to change and change. They're not going to sell your policy away to some other company. And that I have seen that recently. Probably the biggest, most important thing is own occupation. And that's specifically if you can't do the job that you're doing, for instance, this being a dentist, that you're covered. Now, with own occupation, between companies and between policies, even within companies, there's a very vast difference in the wording. And really, the wording of the contract written by a bunch of lawyers for a bunch of lawyers gets confusing to us because that's not our world. And sadly enough, I see enough people that say, oh, I have an own occ policy, an own occupation policy. Well, yes, but the caveat to that, there can be a whole lot of different levels of what an own occupation policy may look like or might not look like. So we really need to understand that, or sit down with someone like myself or somebody else that does this a whole lot to be able to explain and understand what those differences are. Another thing that a lot of people don't really think about is most people do not end up in a position like myself, which is fully out of dentistry, of general dentistry, practicing the way I was. So with permanent nerve damage in my hand, most people, they slip on the ice or they go skiing or they pull and they hurt their thumb or something like that, or they tear their Achilles and they're out for a period of time. Let's say we'll use the thumb analogy. You slipped on the ice, you had to have a thumb surgery, you're going to be at 8, 9, 11 months, something like that, but you're going back to work. That falls under the partial disability space. And the wording within partial disability policy contract, within that contract, can vary from company to company as well, and be very critical in terms of if you're going to get any payment or not. And sadly, once again, most people don't know that that's the situation. They believe that they're fully covered and that's it. Other things that we think that I tend to think are probably pretty important, something to add on to or think about with the policies, the ability to increase it in the future, because you're going to get it for a certain amount when you're making a certain amount. And typically most of us make more later. We want to be able to cover more of our income later on as we go. I see a lot of people that for different reasons decided not to go with the future increase option. So they're capped. They can only get 5,000, 6,000 a month. And that's it. They're not able to get more because they didn't exercise that option to add the future increase availability without proof of insurability medically. Just all we have to do is prove that they made more. The other things, there's the cost of living adjustment. That can be very important. If you get hurt when you're 30 and you have a policy that goes to the age of 65, that's 35 years that a company would be paying you theoretically, and the cost of money changes over time. And so if you don't have the ability for that to increase over time with the cost of living adjustments, you basically are getting less and less as the years go along based on inflation. So I think that can be a very important thing as well. Other things to look at: student loan riders. There's ability to have student loans or supplemental riders that can be put on as well to help carry for, typically it's a 10-year period of time where they have an additional amount on there that can help cover student loans. And as we all know, most of the younger people getting out have significant student loans. And the last thing is what a lot of people don't know is if you are just out, you can acquire a policy as young as the first day of your 4th year of dental school, and up to depending on the company, some will allow up to a year after you graduate, up to just to that year, to get a discount, a student discount for a resident or a general dental D4, that just got out. So those are some things that I really feel to be important. I'm trying to be as generic and basic as I can, but I really feel those things are probably the keys to the most robust policy.
So, Dr. Osterday, what would be the best thing if somebody like me have been practicing like 20 years, and should we consult with you with the policy that we have? Because we don't really know. Like personally, I don't know much about my policy well enough that I
So,
can be comfortable to say, okay, I'm preparing for myself. So, what would I do for that?
well, typically what happens is I have individuals that would contact me through my email address or through my cell phone, and they would or they find me on Facebook the
Mm-hmm.
other way,
Yeah.
and they would then I would spend time looking at your policy, seeing what you have, and
Mm-hmm.
trying my best to explain to you
Mm-hmm.
what it is that you have and what you possess,
Yeah.
and should that be good enough to you.
Mm-hmm.
Some people will do. Some people. I just talked to an individual today.
Mm-hmm.
Right out of dental school, he got a small policy.
Mm-hmm.
He's making significantly more money than that now, and he
Mm-hmm.
wants to add to it. He doesn't have that future increase option. So what he's going to do is we're talking to him about maybe adding an additional policy. I think a lot of people don't realize you can add a different company's policy over the one you had that you got very early on. So it's not uncommon for people to have two, maybe even three different companies as policies added layered on top of each other to get the maximum amount. The thing is the older, typically insurance works based on the price is based on age and health, and you're typically not any younger or healthier than you are today.
Mm-hmm.
So as you get older, the cost goes up a little bit. So that's why I'll often, if someone has a fairly good policy put in place that they got pretty young, we kind of want to keep that as long as it's one of the premier carriers. If it's not, then it might not make the most sense to keep something that may not pay you
Mm-hmm.
if you actually get sick or injured.
Right.
So that's kind of what we look at. So yeah, there's that tipping point to where, what's most important, quality or price.
Mm-hmm.
And I always tell people that in dentistry, generally speaking, most dentists make enough money to be able to afford the best disability insurance that they have, that they can acquire. And if you happen to get into a car wreck
Mm-hmm.
and they're putting you on a stretcher, taking you to the hospital, and your thumb and hand is mangled, and you look down at it, you don't want to think, boy, I hope my disability insurance is pretty good, but I know that I could have gotten better, but I paid less.
Mm-hmm.
That's the wrong time, and it's too late.
Mm-hmm.
So we all, generally speaking, in dentistry, we all can afford it.
Mm-hmm.
I can't imagine wanting to go with something that's less than the best that I could provide for my family. That's the way I look at it time and time again. And it happens. It happens. People get sick and injured a lot
Absolutely.
more. I could go on for hours telling you things that I've seen and heard.
Yes,
It's
absolutely.
unbelievable.
Yeah. That's exactly right. Would you just share with us like one or two story, not from you, but from other dentists that it happened and you witness and you see his or her struggle with his policy. Somehow it didn't get him or her to the level that he want or she wanted to be.
Well, I'll give you two examples of I'll give you two examples of something that has come up very recently.
Mm,
Um, we helped an individual acquire a policy last year.
mm,
Young person, not even 30 yet.
mm,
They just got a policy with the ability to have a future increase, cost of living, all that stuff. They decided it was worth it. They were out of school, and that was worth it. Just this past week, they're being referred to testing for early stage ALS.
wow. Wow.
So they are going to get, if that does happen, their
Mm-hmm.
family will be entitled, they will receive a good amount of monthly disability should that individual not be able to work.
Mm,
Another one was an interesting case where I've spoken to this person a few times. They
mm,
were less than 1 month out of a residency, AEGD or GPR. Honestly, I can't remember which.
mm-hmm.
They had some type of seizure neurologic event, ended up bedridden to the point where they can barely walk, only
Mm,
to basically go to the restroom and take care of themselves or walk into the doctor's offices, stuff like that. The
mm-hmm.
individual's spouse had to quit work, stay home, and take care of this person.
Mm,
They are destitute, poor, and don't know how they're going to financially survive.
mm-hmm.
This person did not have disability insurance. They were 1 month out of a residency program. Very young individual as well.
Wow.
So because they didn't do that, or they waited or said, oh, I'll do it in the future and maybe next year, I'll make more money.
Mm-hmm.
They're literally living in a financial crisis indefinitely because of it. And it's sad. And I know that it can be fixed. And that's something that I try passionately to get people to understand, that it can and will happen to people. And we just hope it's not you. I always tell people that I speak to, if you can tell me when, how, where you'll get sick or injured, I'll tell you what the best disability policy is for you. Obviously, that's not the case.
Mm-hmm.
So preparing ahead of time makes all the difference.
Wonderful. So thank you so much. Could you just give it a general idea, on average, the how much would it cost for a good policy versus like a decent policy for a dental disability for a dentist or any of those specialists that um,
I've for someone particularly right out of school, let's use a younger criteria because everybody's ages can be different. I mean, I've seen very strongly worded policies in the 40 something dollar a month range for people up
mm,
to 100 and something dollar a month range, which when you're right out of school, that can
mm,
become expensive. But
mhm.
as we get older, that's not that's not as much. There's
Yes.
another thing that I forgot to mention, and thank you for kind of reminding me on the policies. Um, the cost between different companies or between different policies can change based on what the person that helped you to acquire the policy checks their box. Some of the policies, some of the group policies, some of the like association policies, for instance, are what's called graded. So it sounds great now, and you
Mm,
pay a small amount now, and as you go along, it becomes double, triple the cost as you get older in your 40s and 50s and 60s even. It becomes prohibitively expensive. I kind of tend to feel that the fixed cost, while upfront is a little more expensive for the first, I don't know, 7, 8 years per se, is going to be more expensive. But over the next 30 years, you're paying for that policy, 25 years, however long you pay for that policy, the cost stays fixed. So if you're going to pay $100 a month now, you're going to pay $100 a month in 10 years, 20 years. And it, in essence, due to inflation, it becomes less expensive over time. So I feel that the fixed policy cost tends to be a pretty big thing, particularly if you're planning on keeping your policy for a long period of time. So yeah, I would expect that a young person to get a base policy, I'll just throw a ballpark out, 100 to 150 a month could get you most most things, but it would be very speculative for me to say that. It's not going to be $1,000 a month, and it's not going to be $10 a month. Let's just throw that number out there and say that it's, it depends on everybody's instance and situation, but there's a ballpark.
Wonderful. So for somebody who been practicing like 20 years, 25 years, would you say the cost of the disability probably somewhere less than $500 or less or maximum cost? Like what would be like, would you consider like I want to pay top amount money for the disability insurance? How much do you think I have to pay?
It all depends on how much, really what it comes down to is depends on how much of your income you want to try to protect.
Mm-hmm.
So traditionally 60 to 70% of the income is it's what's able to be protected. They will not allow you to go to multiple companies and get 60% on multiple companies. It's 60% total amongst all your policies put together. So if someone wanted to do that, let's say a 40-year-old male with no health issues whatsoever, that's healthy and takes no meds and never has,
Mm-hmm.
and they want to cover, a 60% of an average doctor salary, I have seen people pay $1,000 a month if they way into their 40s, and I've seen people pay $300 and $400 a month,
Mm-hmm.
depending on their medical situation and what policies they're trying to acquire.
Mm.
So it can vary dramatically, like I said, based on what someone chooses to add or not add to their policies, their health, their age, a little bit of everything.
I see. And then you mentioned something that I actually learned recently that you mentioned is the dental disability doesn't have to be everything related to your hand. It could be your health, could be your emotional problem, or could be anything. Would you say that, or it could have to be
Yes,
something? Yes.
it
Okay.
doesn't have to be related. It can be for any reason. If
Okay.
you become sick or injured for any capacity in any capacity, you are covered. Generally speaking, if you have the right wording of your policies,
Mm-hmm.
you would be covered for the period of time upon which you have that policy put in place. Some people only have a 2 year or a 5 year payout or a 10 year payout. Some have to age 65, some have to age 67. It depends on what policy that person acquired.
Okay.
So,
Very good.
I mean, generally speaking, amongst your better policies, it is to a certain period of years that you did, and it doesn't have to be just because your back or your neck or your hand. It can be anything.
Wow, you are a resourceful person to for those of you watching and listening to our conversation about dental disability, how you repair yourself for your future family planning and your health, your covers for your family and your backup plan for your future plan for, in case you have incapacity or inability to work at the regular dentist. So watch this. You will learn a lot from Dr. Bryan Osterday today. Okay, so thank you so much for that really quick overall information about how we can reach out to get to know the resource that available through you or from other people that you work with. So
Yeah, I will say my email, if someone needed to get in touch with me, the easiest is it's Osterday at Gmail. Osterday at Gmail. That's
okay,
probably the easiest way.
yes, yes. And would you share with us, let's say if we cannot do dentistry anymore, what can we do in dentistry? If we just like, oh, I cannot really hold a handpiece anymore.
Depends on the well, so it depends on if you're talking in terms of disability insurance. It depends if you had an own occupation provision within that.
Hmm.
If you have a specific type of own occupation where you're allowed to go back and still get paid by the disability company your monthly amount and go back and have another job or another try something else. It can be anything you want. It could be any profession, not just in dentistry, for a lot of the policies. In my instance, in my case, I could not do general dentistry anymore because I can't grip properly in my hand, and it hurts, and I have issues with it. I actually have a sleep apnea practice, so I went back and got my diplomate status for the American Academy of Dental Sleep Medicine, and open a practice where I just see patients for sleep medicine now.
Hmm. Okay. Now, I have a friend who have disability in his back, and the disability insurance company watching him, even he cannot do surfing anymore. He cannot do anything like that. Is that something that is making sense? Like you cannot do any more exercise. That's
Well,
not.
it depends on what the problem that someone had. If someone says that they had a serious back injury to the point where they can't do dentistry and then they're surfing or
Hmm.
rock climbing, I could see where the insurance company could say, hey, we need to talk about this.
Hmm.
So I think there are instances where that can be debatable amongst the insurance company to the individual. I could not speak on specifics to that, but I could see that. But if it's something that's understandable, if you lost an eye due to a car wreck or something, and you're not going to have the depth perception to be practicing whatever type of dentistry that you did, whether it be ortho or endo or general or whatever, um, it's typically not something to be debated, and you can go back and do something else. In my case, I had a strong desire to still try my best to see patients, so I'm able on a very part-time basis to go in and still do sleep. So I'm able to do that, and I don't need my hands per se the way I did, so I'm still able to satisfy my mind, if you will, and still be able to treat patients and do something productive with that. So
Would the insurance people have to go into your office and see what you do, or you're not gonna allow them to do that? I mean,
what the disability providers,
yes,
the
yes.
disability care, it depends on the situation. If someone is deemed to be permanently disabled, have
Hmm.
a potentially career ending situation, typically what they'll do is the insurance companies will ask for documentation to prove that the individual is telling the truth. If you needed to see an orthopedic surgeon or a back surgeon or something, or a neurologist or a neurosurgeon or something like that, they
Hmm.
typically would ask for documentation and proof of that. They may or may not send someone out to visit with you and talk about it. It's very company specific and injury specific, but I have seen and heard of all of that happening. Yes.
Okay,
I
okay.
don't know that they watch. I don't know. I don't know what companies do, if they look out long term or not, or I don't know that. I would assume that if someone's out on something that they say hurts, but it's hard to quantify, then they probably are being looked at.
Yeah, right. I think the reason I asked it, for example, let's say if you have the evidence of the doctor telling you that, okay, or you tell yourself I cannot do any dentistry anymore, but I actually want to get involved with dentistry, and you are going to the clinic, and you declare to the insurance that yes, I'm going to my clinic, but I'm not doing dentistry. I'm doing sleep medicine. The Would they say, okay, I'm going to go inside and see what you do? Do they do that?
They can, and it also depends if you had what type of insurance policy you had. Let me go back to that. If you had an own occupation policy versus an any occupation policy. So if you have an any occupation policy, so if you can do any job, be a Walmart greeter, be a driver's ed teacher, whatever. If you have that type of policy, you can't do anything, or if you can do anything else, there's a good chance they won't pay. If you have a true like specialty specific own occupation type of disability policy, then there's a greater chance that you'll be able to go back and do something else other than the exact type of procedures and dentistry that you were doing.
Okay, okay. So that's something that you would look for us, the policy, and help us understand more when we get
Yes.
when. Okay, thank you so much.
Yes, I can't stress enough that every single individual, that there are significant differences between someone. When I always shudder when people say I talked to some guy and he told me that I need company X or company Y, and I said, well, how long did you talk to him? Oh, 2 minutes. They said they get everybody the same thing, and I don't think that's probably the wisest move,
Okay.
or the most thorough way of helping people.
Yes, yes.
So
Thank you again for that. And would you share a little bit about the sleep medicine and how someone like you able to continue with the sleep medicine? And you feel that this, sleep medicine is the things that is can fulfill your dentistry at a dentist, and what exactly you do with the sleep medicine, Dr. Osterday?
so first and foremost, I think that sleep dentistry, sleep medicine, and dentistry is becoming significantly more popular, and people are learning and understanding more about it.
Hmm.
What I'm concerned with is a whole lot of people are going out and learning just enough about it, but probably not as much as they could or should.
Yes.
and and I feel very strongly that there should be some protocols put in place and some training, some significant amount of training. If we're going to do something in our profession of dentistry, we should be as proficient and competent about it as possible. So I felt that way. So I made sure that I went and did the most I could do and try to get as much continuing education and understanding of the field as possible. So I went through the American Academy of Dental Sleep Medicine, through their track, and became a diplomate on it because I felt that that was best for me. And I
Mm,
think for our profession in general, I think the training that they have is very robust and very good. I know that there's at least one dental school that I'm aware of that has a actual residency program through that. I think others are either forming or have formed as well.
mm,
And I think that you're probably going to see a trend of that in the future as we go along, with more and more schools getting a formal education process put in there. I think that's probably a good thing. That
mhm,
being said, can we all do it? Absolutely. As a dentist, we have the ability to do it. We just need to make sure that we're following the certain protocols and guidelines and standards. And as long as that's being done, there is an untapped market for people. There are literally millions of people in the United States that could or should have that discussion about apnea and or their breathing and what can be done, because it's very, very important. So
Do you-
for me, it fulfills my ability to still feel like I'm helping. And it's a very valuable thing to people that most people don't really know, that they can do something, that we can do something to help them.
mm, beautiful. Now, do you see young children in your clinic?
No.
Hmm.
No, typically not. Those would be more of an orthodontist based
Hmm.
airway type of thing, with them still growing. We are doing fixed appliances in place, and fixed appliances on kids growing is not where I feel comfortable treating. I feel more comfortable with the orthodontist treating them, and I would refer appropriately for space maintenance with an board certified orthodontist, for instance,
Hmm.
in my practice. That's where I feel the most comfortable. I know there are people that are doing sleep management and sleep dentistry with children. That's just not what I find
Hmm.
that I do.
I see. I see. Now, in terms of the airway space, throughout your practice in sleep medicine, you see the correlation between class one, class two, class three occlusion and how the airway space can be physiology related or not really?
Well, you would like to think that class 3 individuals would have a greater chance of having less airway issues, and I know there's been a lot of research to look into that and into the different physiology between the classes. In my experience, I haven't seen a whole lot of difference. To
Hmm.
me, it's more of the individual that maybe could be overweight
Hmm.
or things like that. So, like larger tongue,
Hmm.
smaller whatever, that to
Yeah.
me seems to be the factor that's more glaring, at least in my experience.
Okay. I see. Thank you very much. And what about like occlusion, like crowded teeth and narrow arch? That could be contributions or not really?
Oh yeah. Yeah, it can be if you
Mm,
have a narrow arch and crowding, yes, because you have
mm,
less space for your tongue.
mm-hmm,
So yeah, that's a commonality that's seen quite often with individuals. Doesn't have to be,
mm-hmm,
but that's something that's seen more often than not. Yeah, if you have crowding, if there's no space for that tongue to fit comfortably or rest comfortably, then yeah, there's an issue there that could happen from that. Absolutely.
okay. How about orthodontist premolar extraction? Do you see it related to you see some of those people come in?
I know that, yes, I have, and I don't want to say that that's, you know, premolar extractions are indicative of a higher incidence of sleep apnea. I don't know. There probably has been a research done on that. I
Mm,
am not familiar with
mm,
any studies that have been done with that. In my experience, I haven't seen that. I will just say though that the bigger, wider the arch, the less likely chance it is for the tongue to be held up or not be able to rest properly. So, in
mm,
my experience, just common sense as a dentist saying if they have a bigger, wider arch, then it's probably less likely for that to happen. And what we see with premolars being extracted, you have a constriction of that arch at times, not always,
mm-hmm,
and so that could potentially lead to an issue. I don't know that it always does, and in my experience, I haven't seen that, but that
mm-hmm.
doesn't mean that my experience is indicative of what everybody sees.
Yeah. In your on your website, you mentioned about the two measurement that you do for the nose and the air space, the esophagus. Is that something that you typically measure every patient?
Yeah, so that's rhinometry and pharyngometry. That's a debatable subject in the
Mm-hmm,
sleep world. Some people believe
mm-hmm,
strongly in it, and some people
mm-hmm,
don't.
mm-hmm,
They the big crux of that is if you're doing airway, if you're trying to measure airway, and when someone's sitting up in a wake, they'll say, "Well, how can you dare tell what they're like when they're laying down and asleep?" And so I can understand that. Um, we help to use that more as a guide and a better understanding that we try to see if someone's already constricted when they're in that position, or maybe so we can help to get an idea of where we would start them on the vertical dimension of have an appliance. That's
mm.
really where we feel that we get the best use out of that.
Okay, thank you. And now, do you use Medicare, medical insurance, or this is just free for service, out of pocket type of practice?
My office is a Medicare provided.
Mm-hmm,
We do have provide for Medicare in that office, which is I believe it was a very, very long, I think like a 27-page application that was quite involved. They
mm,
do multiple site visits. It's a to become a Medicare provider, it's hard to do if you're not doing a specific thing just like sleep, because they'll
mm,
want you to provide that Medicare rate to all services, which obviously can be significantly prohibitive to
mm,
certain dentists. So in our case, we just do sleep in our office. So it's simple. It's one device, one thing. So it's
mm,
one code. So but even that the government has put limits on what types of devices can be used even.
mm,
So so it's so yeah, so we do provide that,
mm,
and generally speaking, most people in the sleep world and most people that are providing sleep medicine will help to file with insurance. some are in network with certain health insurance and some aren't. Everybody will try their best. There are third-party billing services that will help that.
Mm-hmm.
And there's some things coming in the future that I think will probably make that a little bit easier for dentists to help filing with medical insurance. But we're not to that point yet, that we find it incredibly simple.
Dr. Osterday, I really appreciate the time that you allow us to have some time today on the interview on the podcast today. It will be really helpful that dentists like me and my college friend watch this again and contact you for more information about how they can repair themselves for the future plan for the dental disability benefit. So I
Yep,
really appreciate your time, and we hope to see you another time for some point in our cross in the future.
absolutely. Looking forward to it.
Thank you. Take care. You have a
Thank you.
wonderful day.
Okay, you too. Goodbye.
Yep.